Hey everybody, it's Dr. Kadisha, your board certified emergency medicine physician and best-selling author of the book Help Us Help You in the Emergency Room, what a doctor, an ER doctor would tell you if she only had the time. Now I know I haven't been here for a while. I've been traveling a lot. I've been seeing clients, patients, just doing a lot of work, writing, working on my kit, my Mobile MD kit. It's launching, and I'm offering a Black Friday safety bundle that goes through. The offer goes through Cyber Monday. And check that out at www.themobilemdkit.com. That's TheMobilemdKit.com. And I'm here to speak to you, though, about a very serious topic. Today is World AIDS Day, and I just want to go over some things that we all should keep in mind, especially since it's really interesting that December 1st is World AIDS Day, and because it's during cold and flu season. And some of the symptoms that one gets when coming down with HIV are very similar to cold and flu symptoms. Okay, so like stage 1 of in HIV infection, it's the acute HIV infection. Those things happen within 2 to 4 weeks after infection with HIV, and about 2/3 of people will have a flu-like illness. And this is the body's natural response to HIV infection. And those include fever, chills, a rash, night sweats, muscle aches, sore throat, fatigue, swollen lymph nodes, and mouth ulcers, which aren't so common with the flu, but common symptoms of the flu include fevers or feeling feverish, feeling chills, coughing, sore throat, runny or stuffy nose, muscle or body aches, headaches, and fatigue. And that's why that was one thing that I really wanted to focus on. People are talking about all kinds of things on this day, on World HIV/AIDS Day, but I wanted to point out that important similarity, since we're right in the middle, or we're getting into cold and flu season. Now, the symptoms of HIV acute infection can last anywhere from a few days to several weeks. Some people don't have any symptoms at all during this early stage of HIV. Now, don't assume that you have HIV just because you have any of these symptoms. Like I'm saying, they can be caused or similar to many other illnesses. But the important thing is, if you think that you've been exposed to HIV, get tested. I know that fear is a big factor that keeps people from getting tested, but that also keeps people transmitting HIV unknowingly, that fear. And so request an HIV test from your primary care doctor. There are also convenient at-home kits that you can take. Because it's really important to know your status after you get tested. I know it's a scary thing, but be sure to learn your test results. And if you're HIV positive, see your doctor as soon as possible so that you can get treatment. And be aware, if you're in the early stages of HIV infection, you're at high risk, very high risk of transmitting it to others. So take important steps to reduce your risk of transmission. If you're HIV negative, there are prevention options like pre-exposure prophylaxis, also known as PrEP, that can help you stay negative. Okay, so stage 2 is the clinical latency stage, where the HIV virus is still multiplying, but it's at very low levels. And people in this stage might not feel sick or have any symptoms at all. This stage is also called chronic HIV infection. And without HIV treatment, and that's one of the most important things that I'm trying to relay, is to get tested, but also get treatment and take treatment consistently. Because without HIV treatment, people can stay in this stage for 10 to 15 years. Some people move through this clinical latency stage a little faster. Okay, so that's stage 2. Stage 1 is the acute infection that can resemble a flu-like illness. So we're on stage 2, clinical latency. If you take your HIV treatment every day exactly as prescribed, and you keep an undetectable viral load, you can protect your health and prevent transmission to others. If your viral load is detectable, however, you can still transmit HIV during this stage, even when you have no symptoms. So if you have a detectable viral load, you can transmit HIV during this clinically latent stage, even when you have no symptoms. So it's important to see your healthcare provider regularly to get your viral load checked. Okay, because stage 3 is what happens when you don't take your treatment as prescribed consistently. If you have HIV and you're not on treatment, eventually the virus will weaken your body's immune system and you will progress to AIDS, which is the acquired immune deficiency syndrome. This is the late stage of HIV infection, and symptoms of AIDS can include rapid weight loss, recurring fever or prolonged profuse night sweats, extreme and unexplained fatigue, prolonged swelling of the lymph nodes, like in the armpits, groin, or the neck area, diarrhea lasting more than a week. And again, I wanted to mention this. This is really important to discuss today because I'm seeing a lot of patients who are coming for diarrhea, especially after Thanksgiving, and flu-like symptoms because it's cold and flu symptom season. And folks are also getting diarrhea as part of various viral syndromes. But it's just interesting that HIV is yet another one of these viruses. So diarrhea that lasts more than a week, sores of the mouth, anus, or genitals, pneumonia, or red, brown, or pink blotches on the skin, or under the skin, inside the mouth, nose, or eyelids, and memory loss, depression, or other neurologic disorders. Each of these symptoms can be related to other illnesses, yes, but the only way to know if you have HIV is to get tested. Many of the severe symptoms and illnesses of HIV disease come from opportunistic infections that occur because the body's immune system has been damaged. These are the kinds of infections that people with normal immune systems do not typically get. It's rare that folks with a normal intact immune system get these things. So see your health provider if you're experiencing any of these symptoms. Now, one thing that is good news is that you have PrEP to help prevent transmission before exposure, and it can also help prevent transmission shortly after being exposed to HIV. Also, if you take your medication as prescribed on a consistent basis and you get an undetectable viral load, your viral load is undetectable, then you are not likely to transmit the virus, and you're more likely to live a long, healthy life, while living with the infection. So, and I keep saying get tested. How often should people get tested? Everyone from the ages of 15 to 64 should get tested at least once, regardless of your risk factors. People who have occasional exposure to HIV risks should be tested at least once a year. And people who are at high risk for HIV infection should get tested every 3 to 6 months. Okay, so And like I was saying, HIV can go undetected for many years, and so that's why it's good to, especially if you know you're high risk, to get tested. Okay, so and who are people who are at risk? Now, having HIV can affect just about any group, any group. But people who have multiple partners, unprotected sex with multiple partners, if you are an IV drug user and you share needles, that is another risk factor for HIV. Okay, but just know that HIV cannot be passed on through things like just touching someone, just kissing someone, or sharing cutlery or glasses. HIV can be passed through sex without a condom, but only if a person is not on effective treatment. It can also be passed on through sharing needles and during pregnancy. Okay? Again, HIV can affect anyone. Some groups of people are affected by HIV more than others, but it can be passed on to anyone. And people living with HIV can live long and healthy lives. Although there isn't a cure for HIV, there is excellent treatment now. And if you are diagnosed in good time and take your medication, you can have a long and healthy life like many other people. But so there are many ways to prevent HIV. I just want to end with that. One, getting tested regularly if you are sexually active. Being sexually active is a risk factor for HIV. Taking PrEP or which is pre-exposure prophylaxis, or PEP, PEP, which is post-exposure prophylaxis. That's another way to help prevent it. And again, these tablets are the antiretrovirals which help prevent HIV either before or just after you've been exposed to HIV. So that's number 2. So the first one is getting tested regularly if you're sexually active. Number 2 is taking PrEP or PEP, PEP. Number 3 is using condoms. Number 4 is never sharing needles. And number 5 is taking your medication if you are living with HIV. You are helping to prevent other people, likely loved ones, from getting HIV. So again, I'm Dr. Khadisha, your board-certified emergency medicine physician and best-selling author of the book, Help Us Help You in the Emergency Room. And do follow me on Facebook, Instagram, and Twitter at Dr. Khadisha MD. That's DrKadishamD. And my website is also the same, drkhadishamd.com. So again, drkadishamd.com is my website. Check out my book at www.helpushelpyoubook.com, and I will see you next time. Thank you so much for joining me for World AIDS Day.